The COVID-19 experience is drastically different from person to person, and the experience you will have is often determined by your current state of health. Heart disease can drastically increase the risk of COVID-19 complications. Heart disease is also the number one killer in the U.S., according to the CDC. 1 in 4 Americans will succumb to it.
What people term as heart disease in general, which generally refers to blocked arteries, someone who has stents or someone who's had a heart attack or even bypass surgery. We know for certain, both those populations of heart patients are at increased risk for significant or severe COVID-19 infection.
We know that COVID-19 is primarily a disease that attacks the respiratory system, not the circulatory system of which the heart is central. So what's the link? When your respiratory system is being attacked, your oxygen levels can dive. This in turn affects the oxygen levels in your circulatory system, which may already be compromised due to ongoing heart disease. People with compromised health must therefore take precautions that much more seriously.
My patients, who are at risk, number one, I always discuss prevention. I try to be as honest with my patients and I urge them, to continue safe practices, particularly before they have the vaccine, and then even do so after, to maintain safety and hopefully, continue to reduce spread.
There are some indications that COVID-19 may have negative effects on the body long after recovery, but the current level of data is still too sparse for a definitive conclusion on the matter.
The good news is the vast majority of people who are infected with COVID will have no short-term cardiac effects that we know of.
Heart attack deaths have gone up since the pandemic, and there is some speculation that may be the result of people being more hesitant to receive care due to fear of exposure at medical facilities.
The risk of getting infected once you're in a hospital if you weren't infected beforehand is very low.
Medical facilities are, by design, top-notch in sanitation efforts. For this week's Doc Talk, I'm Ed Russo, CBS 21 News.